Welcome to Legacy Weight and Diabetes Institute. Today, we are excited to share with you some information about our bariatric surgery program. Today, we will review with you who qualifies for surgery, the different types of weight loss surgeries, the risks and benefits, and the commitment required to make surgery successful. So, what is obesity? Obesity can be defined as an excessive accumulation of fat or a BMI of greater than 30. Severe or morbid obesity is a BMI greater than 35, which means a person is about 100 pounds overweight. Body mass index is an easy screening tool to determine what weight category a person falls into. Normal weight is considered a BMI of 18.5 to 25, and as mentioned, obesity is classified as a BMI of 30 or greater. BMI is a good screening tool, but may not be an accurate indicator of health for all individuals, such as athletes who have a high muscle mass. Obesity can be caused by many factors. Some causes are a poor diet, inactive lifestyle, and family genetics. When calories ingested are greater than the calories burned with daily activity, this causes an energy imbalance, and unused energy is stored as body fat. Obesity is a disease that is associated with many other illnesses. This includes heart disease, diabetes, some cancers, gallbladder disease, infections, and poor circulation. Obesity is one of the most common causes of preventable death. Weight loss surgeries have proven to be an effective method for weight loss in those who qualify. To qualify for weight loss surgery, you must have a BMI, a body mass index, greater than 40. You may also qualify if you have a body mass index that is greater than 35 with certain health conditions related to your weight. Specifically, these are diabetes, high blood pressure, heart disease, severe sleep apnea, and certain other medical conditions. This level of body mass index typically means you are at least 100 pounds overweight. There are a few other criteria needed to qualify for bariatric surgery. Patients must understand and be ready for the lifestyle changes which must be made after bariatric surgery. With the motivation to commit to them, patients' mental health will also need to be well managed. In addition, surgery should be an option only after other attempts to achieve weight loss have failed. These could include previous diet changes, nutrition counseling, drug therapy, and exercise programs. In addition, there are other malabsorption procedures that you can discuss with your surgeon. At Legacy Weight and Diabetes Institute, we perform several different weight loss surgeries. Specifically, these are the gastric bypass and sleeve gastrectomy. You may ask how weight loss surgery works. In most surgeries, the stomach is made smaller. This restricts the amount of food you can eat at one time. Patients feel full faster with less food. The gastric bypass and sleeve gastrectomy all restrict the amount of food you can eat at one time. In addition to restriction with gastric bypass, because some of the intestines are bypassed, there is some malabsorption, which means your body may not absorb and use all of the food that you eat. Most often, these surgeries are performed using a laparoscopic approach. This means several small incisions are made, in which small instruments and a video camera are inserted and used to operate. On occasion, the open approach may be used, which means one larger incision is made. Now, we are going to review in more detail the different weight loss surgeries. The Roux-en-Y gastric bypass is a procedure in which the stomach is divided so that only a small pouch receives food from the esophagus after it is swallowed. The pouch is about the size of a golf ball. The small intestines are also cut. One end of the intestine is connected to the pouch, and the other end is reconnected further down the small intestine. This is where bile from the liver, digestive juices, and enzymes are brought to assist with digestion of food. Weight is lost after the gastric bypass because the amount of food calories that can be ingested is reduced. Patients feel full faster due to the small size of the stomach pouch. Additionally, because a portion of the intestines is bypassed, not all calories consumed are absorbed and used by the body. It has also been found that the urge to eat is often decreased. Patients who have gastric bypass, on average, lose 55 to 60% of their excess body weight long term, and most weight is lost in the first year after surgery. There are many considerations to make when deciding if the gastric bypass is the best option for you. In addition to weight loss, the gastric bypass has been shown to be helpful in the treatment of diabetes and gastroesophageal reflux disease. There is also long-term data showing the sustainability of weight loss after having the gastric bypass. It is also important to know that after the gastric bypass surgery, vitamins and minerals are not absorbed as well. So you will be required to take vitamin supplements for life in order to stay healthy. The gastric bypass may not be appropriate in patients with some health conditions. This includes anemia and Crohn's disease. Additionally, individuals who require frequent steroid use or need to take anti-inflammatory medications like ibuprofen to manage other medical problems would likely not be good candidates for the gastric bypass surgery. We will now watch a brief video on the gastric bypass surgery.
To gain access to the abdominal cavity, small incisions are created on the abdomen. Trocars, which serve as passageways for the surgical instruments, are placed into the incisions. The surgical instruments are passed through the trocars to access the abdominal cavity. The surgeon examines the abdominal cavity using a laparoscope or video camera. A small stomach pouch is created using a stapling device. The small intestine is separated into two sections. The lower portion of the small intestine is attached to the newly created stomach pouch. This allows food to pass directly into the small intestine, where digestion continues. The upper portion of the small intestine is reconnected to the lower part of the intestine. The bile and pancreatic fluids from the liver and pancreas allow food to be completely digested. By altering the anatomy of the gastrointestinal tract, gastric bypass changes signals in the body, resulting in decreased hunger and increased feelings of fullness after meals. As with all weight loss procedures, behavior modification and dietary compliance plays a critical part in determining the long-term success of the procedure.
Now that we have reviewed the gastric bypass surgery, we will discuss the sleeve gastrectomy. The vertical sleeve gastrectomy is a restrictive procedure where the majority of the stomach is cut and removed. This creates a slim banana or sleeve-like tube. The remaining stomach capacity is about 1 to 5 ounces. In this procedure, the nerves of the stomach and its outlet to the intestine remain intact, so the normal functions of the stomach are preserved. However, since a large part of the stomach is removed, this procedure cannot be reversed. Weight is lost after the sleeve gastrectomy because the amount of food calories that can be consumed is reduced. Patients feel full faster due to the small size of the remaining stomach. Additionally, it has been found that the urge to eat is often decreased after surgery. This is attributed to the removal of the stomach portion responsible for secreting ghrelin. Ghrelin is a hormone responsible for appetite and hunger. Patients who have the sleeve gastrectomy on average lose 50 to 55% of their excess body weight long term, and most weight is lost in the first year after surgery. The sleeve gastrectomy has several advantages over other weight loss procedures. Since the pylorus, where the stomach connects to the intestines, is preserved, dumping syndrome is less likely than in the gastric bypass. Most foods, although in smaller amounts, can be eaten and digested normally. Because digested foods are absorbed as before, problems related to vitamin and protein deficiencies are minimal, but some vitamins will be required for life. Unlike the gastric bypass, anti-inflammatory medications like ibuprofen are usually safe to take after the sleeve gastrectomy. Additionally, because there is no rerouting of the intestinal tract, there is less risk for obstructions to occur. The sleeve gastrectomy is a newer procedure than the gastric bypass, so there is less data on the sustainability of weight loss long term. Additionally, because there is no intestinal bypass, there is potential for inadequate weight loss or weight regain. It is important to remember success depends largely on the patient's following of the nutrition recommendations, especially because unhealthy foods like ice cream and fried foods are often tolerated and absorbed with the sleeve gastrectomy. We will now watch a brief video on the sleeve gastrectomy.
To gain access to the abdominal cavity, small incisions are created on the abdomen. Trocars, which serve as passageways for the surgical instruments, are placed into the incisions. The surgical instruments are passed through the trocars to access the abdominal cavity. The surgeon examines the abdominal cavity using a laparoscope or video camera. The average human stomach can expand to hold around 1 to 1.5 liters of food. While in the stomach, food is mixed with digestive enzymes to help break down the food to a more simple form, so that it can be more easily digested and absorbed when it is in the small bowel. During a sleeve gastrectomy, a thin vertical sleeve is created by using a stapling device. This sleeve will typically hold between 50 and 150 milliliters, or is about the size of a banana. The excised portion of the stomach is removed. By altering the anatomy of the gastrointestinal tract, sleeve gastrectomy changes signals in the body, resulting in decreased hunger and increased feelings of fullness after meals. The bile and pancreatic fluid from the liver and pancreas mix with the food and allow it to be completely digested and absorbed in the bowel. There is no rerouting of the small bowel or post-operative adjustments needed for the sleeve gastrectomy. As with all weight loss procedures, behavior modification and dietary compliance plays a critical part in determining the long-term success of the procedure.
As with any surgery, there are many possible complications with weight loss surgeries. During your pre-surgical appointment, we will further discuss these risks, and you will learn some things that you can do to decrease the likelihood of these complications occurring. Some possible complications of weight loss surgery include bleeding, intestinal blockage from scarring or an internal hernia, infection, nausea and/or vomiting. Heartburn. You may be given a medication to treat heartburn and nausea after surgery. Scarring, where the stomach connects to the small bowel in a gastric bypass, or in the stomach after a sleeve gastrectomy. This can partially block food from going through. Stomach ulcers are also possible. Gallstones. Rapid weight loss increases the risk of gallstones. We may give you a medication to reduce your risk. Abdominal wall hernia. Injury to spleen or other internal organs. Pulmonary embolism. This occurs when a blood clot, usually from your lower leg, breaks loose and travels to the lungs. Heart attack. Pneumonia. Leak. This is when digestive fluid leaks out of the stomach or intestines and into your belly. And as with any surgical procedure, there is always the risk of death. Complications related to medications are also possible after surgery. Thus, it will be very important to take only the medications listed on your discharge paperwork. After surgery, medications can be absorbed differently, and you are at an increased risk for serious problems related to some medications. Medications such as sleeping pills, sedatives, and narcotic pain medicine can increase your risk for breathing problems and death after surgery. If you have sleep apnea, this can further increase these risks, so it will be very important to use your CPAP machine. There are many benefits to weight loss surgery. As you lose weight, you will likely see an improvement in obesity-related diseases and conditions. This includes diabetes, high blood pressure, sleep apnea, and stress incontinence. Diseases of the musculoskeletal system, like arthritis, may not totally be reversed. However, there may be some improvement of symptoms with weight loss. Most patients experience a significant improvement in the quality of their life, with increased participation in family and social activities and improved self-confidence that occurs with successful weight loss. Maintaining the healthy lifestyle changes you will need to make will be important in your long-term success after weight loss surgery. And nutrition will be a key component of this. For long-lasting success, patients should eat frequent, small meals even if they are not hungry. You will also need to chew your food very well. In general, a total of 4 to 6 small meals with snacks each day is recommended. Protein-rich foods like lean chicken, fish, and turkey, as well as complex carbohydrates like whole wheat grains, will make you feel good and are usually well tolerated. Try to avoid fatty, fried, and sugary foods like sugary drinks, candy, commercial snacks, and fast foods. These can trigger the dumping syndrome, especially after the gastric bypass surgery. Dumping syndrome happens when high-fat and sugary food reaches your intestines too quickly and in a less digested state than the intestines are used to. Some symptoms of dumping syndrome are sweating, shakes, fatigue, nausea, vomiting, and diarrhea. Hydration is also very important. Drink plenty of non-carbonated, zero-calorie or low-calorie beverages like water or Crystal Light. Avoid drinking during meals. Try to limit caffeinated drinks and restrict alcohol intake. Drinking just one alcoholic drink can put you over the legal limit. It is important to remember that patients who have had bariatric surgery have a greater risk of alcohol abuse problems, even if you have no history of alcohol problems. Staying active will also be very important. Rapid weight loss causes a loss of fat, but also muscle. Regular exercise will help to keep and build lean muscle. It will improve your flexibility, balance, core strength, help you in maintaining weight loss long term, and can improve mood and decrease stress. Once you are cleared to exercise, it is good to establish a regular fitness routine. This will help you break weight loss plateaus, adjust the changes in your body weight, and burn calories. So, what do you need to do to prepare for weight loss surgery? Our team will work with you to develop a plan that meets your individual needs. You will begin by seeing many different members of our team who specialize in preparing people for weight loss surgery. Patients start by attending individual appointments with a behavioral health specialist, dietitian, physical therapist, and medical provider. You may also need a sleep study to check for sleep apnea. You may have additional follow-up appointments with these providers based upon your individual needs and entrance requirements. After completing initial requirements, you will meet with your surgeon. Your surgeon will ask you about your eating and exercise habits and your health history. This includes whether or not you feel you are ready to commit to the required lifestyle changes. You will also discuss the reasons why you wish to have bariatric surgery and work together to determine which type of surgery would be best for you. The surgeon will review with you the risks and benefits of the surgeries, and before you proceed, you'll be asked to sign a consent for surgery. This states that you understand the surgery to be performed and its impacts on your life and the risks involved. After your pre-surgical requirements have been met, we will schedule your surgery and a preoperative class. The class will provide you with information on what you can expect throughout your hospitalization, discuss post-operative diet requirements, and review potential complications. You may also be placed on a preoperative diet prior to your surgery. After surgery, we will be here to support you and provide lifetime follow-up. It will be important to closely follow your surgeon's post-operative direction. This will reduce your risk of any complications, such as bleeding, infections, or blood clots. Getting up and walking as soon as you're able can help reduce your risk of blood clots. Most patients are able to go home 1 to 2 days after surgery. Be sure to follow the specific nutrition recommendations after surgery and to sip on fluids throughout the day to stay hydrated. Time off work varies with different job duties. Some patients go back to work after a week or so. Others, who hold very active jobs, may need longer to recover. Follow-up care after surgery will be very important. You'll be scheduled within the first month after surgery to meet with your surgeon, the physical therapist, and the dietitian. This is to make sure you are recovering well and to provide support. You'll be meeting with the behavioral health provider shortly thereafter. The first 2 years after surgery, you'll work closely with our team and have appointments every few months to monitor your health and provide support. We are also here to support you in the long term. After the first 2 years, appointments are recommended annually. We also have a free support group for you to take advantage of to support you throughout your post-operative journey. But we also encourage you to attend this as you prepare for surgery. In addition to our support group, we also have a Facebook support group that we encourage you to join. In conclusion, the gastric bypass and sleeve gastrectomy are safe and successful surgeries. Make an informed decision to have surgery. Become fully aware of the risks and have reasonable expectations about the results. You should be certain you are ready to commit to the required lifestyle changes. Do your own research and talk to your surgeon. For more information, visit our website or join us on Facebook. We look forward to being part of your weight loss journey. Thank you for your interest in Legacy Weight and Diabetes Institute.